Bismillah ar-Rahman ar-Rahim. We will continue with maternal health care. I will be talking about the care before getting pregnant. Preconception care, very important strategy to assure the health of mothers prior to becoming pregnant. We need to do identification of chronic or acute illnesses to view women's health as a continuum. So we adequately implement preconception care to make difference in the future planned pregnancy. This is what we call planning for smooth pregnancy. Preconception care, it's a health program intended to prevent insults to fetal development, to let women have smooth pregnancy. It includes comprehensive physical examination, health education, promotion, nutritional counseling, and identification and change of unhealthy behaviors such as smoking and other unhealthy behaviors. Prenatal care. It is any care delivered to the pregnant woman from the diagnosed pregnancy throughout delivery. Also, why we do it? Increase women's well-being before, during, and after pregnancy, improve self-image, reduce maternal morbidity, mortality, reduce fetal loss, promote development of parenting skills. Also, it will increase the child's well-being, reduce preterm birth, low birth weight, intrauterine growth retardation. It will promote healthy growth and development. It will reduce child abuse and other unhealthy. It will promote family development, positive parent skills, parent-infant interactions. It will reduce the unintended pregnancies because the couple will plan for their pregnancy and for their child. So it is really a good strategy, a golden opportunity for the whole family. And we will identify disorders, family disorders, to prevent child neglect. Prenatal care. Factors related to prenatal care. It might be system, related to system, to health system, long waiting time, insurance. It might be related to factors related to socioeconomic status, obstetric and medical status. We do in prenatal care risk assessment. High-risk situations such as diabetes, hypertension, heart diseases, other diseases, obstetric, as we said, socioeconomic, nutrition status. What about the visits? Visits should continue from conception through delivery. The usual model requires number of visits for low-risk pregnant as once a month until the 28th week, then twice a month until the 36th week, and once weekly until delivery. So the WHO conducted multi-center research to introduce a new model of lower number of prenatal care visits. It's about knowing or exploring the possibility to reduce the number of visits. Can we do that? Yes, because when we did that, or they did that, they concluded that with 4 visits, recommended only 4 prenatal care visits for low-risk pregnancy. It means that pregnancy is a normal event, no need for so many visits. But for those who are with complications or bad history, they need more than 4 visits. Adequate prenatal care, adequate number of visits, and early initiation. That's what we call adequate utilization of prenatal care. It's related to number and timing of first visit. It is associated with better pregnancy outcomes. Research indicates that mothers with adequate prenatal care are less likely to be exposed to pregnancy complications. Actually, maternal mortality is related to pregnancy complications, and pregnancy complications represents almost maybe more than 10%. It's related also to maternal hospitalizations, morbidity, mortality, and preterm delivery. Infants of such mothers are less likely to have low birth weight, preterm birth, infant mortality, morbidity, congenital anomalies, infections, intrauterine growth restrictions, and poor growth and development. What we do in prenatal care first visit: we diagnose pregnancy, we make initial assessment, first trimester, complete history, gestational assessment, we do the lab works, CBC, blood groups, urine analysis, and we give the shots, immunizations. Also, content of prenatal care first visit, we do risk and nutrition assessment. We do health education. Let's look at this risk reduction or awareness of danger signs. What are the danger signs of pregnancy complications? When there is a vaginal bleeding, persistent vomiting, chills or fever, dysuria, abdominal pain or uterine cramping, swelling of the face or fingers, visual disturbances, oliguria, leakage of fluids, decrease in fetal movements, signs of preterm labors, and so on. These are, and there is more than these, what we call pregnancy danger signs. Also, we do a nutrition assessment. Weight gain by body mass index. Women should not gain a lot of weight. The normal is 9 kilograms. Normal pregnancy with normal weight. But when the woman is overweight already, she should not have more than 7 kilograms pregnancy. Blood pressure, urine analysis, examination of the abdomen, glucose tolerance test, iron, folic acid, prenatal multivitamins, reducing psychosocial and environmental risks. This graph represents the mother's weight during pregnancy in association with body mass index. Women's health issues. Women are affected by many social, cultural, and environmental transformations. So, recent trends in women's demographics, reproduction, occupation, and health systems rapidly changing healthcare delivery systems, access to healthcare, have necessitated a new public health vision towards women that consider health in dimensions of social, environmental, and behavioral factors in addition to physical fitness. What about the chronic diseases status? Although women are living longer than men, they experience earlier morbidity and utilize health services at higher rates than men. Among women of childbearing age, asthma, diabetes, and hypertension are the most frequent chronic conditions that limit activities in these women. If we look at Jordanian women with body mass index, they are, for example, age 45 to 49 with the highest body mass index. So it is really a big problem. The body mass index more than 25, which is overweight or obesity, it's a big problem among women. The education, secondary, preparatory, higher education, and secondary is related to better weight, while the women at the ages of 40, 45, 49, no education, 35, even the 30, they have overweight or obesity. Let's look at the public health functions related to two specific women's health concerns, which are perinatal care, and cervical and breast cancer. What we do in public health. Regarding the first function, assure and expand this capacity and competency of health workforce. If we look at perinatal care, we should promote practice credentialing policies, continuous training, support evidence-based practice, which is most important, and develop and advance practice manuals and protocols. Regarding cervical and breast cancer, we should train primary healthcare providers with an educational curricula and material for practicing early detection and screening. The function of evaluation public health services. We should develop indicators for perinatal care through the whole service provision, input, process, output, and monitor them. Regarding cervical and breast cancer, identify barriers to utilization. When we look at the support research, we should address urgent perinatal concerns for local and national level. We should conduct more screening and early detection research regarding the cancers.